I'm Dr. Elizabeth Blackwell, and after 7 years of practicing medicine and staying current with the latest research, I need to share something with you that could change how you think about your blood pressure. A study published in the American Journal of Respiratory and Critical Care Medicine revealed a simple technique that increases a critical blood pressure lowering molecule by 15 times. Not 15%, 15 times. And the technique takes less than 3 minutes. Here's what's fascinating. This molecule, called nitric oxide, is so essential to cardiovascular health that 3 scientists won the Nobel Prize in 1998 for discovering how it works. Your body produces it naturally. It keeps your blood vessels flexible, your blood pressure stable, and your circulation flowing smoothly. But here's the problem. By age 40, your body's nitric oxide production drops by roughly half. By 60, it may have dropped even further. And without adequate nitric oxide, your blood vessels become stiff. They resist blood flow. Pressure builds. What if I told you that you might be sabotaging your own nitric oxide production every single day without knowing it? There's a breathing mistake that most people make constantly, and there's something in your bathroom cabinet that could be making it worse. Today, I'm going to show you 3 evidence-based strategies to boost your nitric oxide naturally. First, I'll explain exactly what nitric oxide does in your body and why it matters so much for your blood pressure. Then I'll teach you the humming technique that research shows can increase nasal nitric oxide by 15-fold in just minutes. And finally, I'll give you a list of specific foods that deliver nitric oxide precursors directly to your system, plus one common habit you need to stop immediately. If you've been struggling to get your blood pressure under control, comment yes below. I want to know if this is hitting home for you. Let me tell you about a patient I'll call Raymond. Raymond was 71 years old when he came to see me. He'd been on blood pressure medication for 8 years. His numbers were technically under control, hovering around 138/86. But he never felt great. Constant fatigue, cold hands and feet. That foggy feeling that made him wonder if he was just getting old. His cardiologist said his numbers were acceptable. His internist said the same. But Raymond knew something wasn't right. I asked him a simple question. Raymond, when you're sitting at your desk or watching television, are you breathing through your nose or your mouth? He thought about it. He didn't know. So I asked him to pay attention for a week. When he came back, he was shocked. His mouth was open almost constantly. While reading, while watching the news. While sleeping, his wife confirmed she heard him snoring with his mouth wide open every night. Here's what Raymond didn't realize. Breathing through your mouth bypasses one of the most important nitric oxide production sites in your entire body. Your paranasal sinuses, those hollow spaces above and around your nose, are factories for nitric oxide. Research from the Karolinska Institute in Sweden found that these sinuses continuously produce and release nitric oxide into your nasal airways. When you breathe through your nose, you inhale this nitric oxide directly into your lungs. When you breathe through your mouth, you get none of it. A study published in Acta Physiologica Scandinavica found that nasal breathing increased tissue oxygenation by 10% compared to mouth breathing. 10% more oxygen reaching your tissues simply by changing which hole you breathe through. And here's where it gets even more interesting. In a landmark 2002 study, researchers discovered something remarkable about humming. When healthy subjects hummed while exhaling through their nose, nasal nitric oxide levels increased 15-fold compared to quiet exhalation. 15 times more of this blood pressure lowering, vessel relaxing, circulation enhancing molecule. From humming. The researchers found that the oscillating airflow produced during humming creates a dramatic increase in the exchange of air between the sinuses and the nasal cavity. Think of it like shaking a container to mix its contents. The vibration from humming releases the nitric oxide that is built up in your sinuses and delivers it into your airways where it can enter your bloodstream. And the effects are immediate. A study on Brahmari pranayama, which is essentially a structured humming breath used in yoga practice, found that just 5 minutes of humming breath induced what researchers called parasympathetic dominance on the cardiovascular system. Both systolic and diastolic blood pressure decreased. Heart rate dropped slightly. Research published in the American Journal of Physiology found that nasal breathing compared to oral breathing acutely lowered mean and diastolic blood pressure in healthy adults. The effects were measurable within minutes. Raymond started with nasal breathing awareness. Every time he caught himself with his mouth open, he closed it. Every morning and evening, he did 3 minutes of gentle humming while breathing through his nose. 6 weeks later, his blood pressure had dropped to 124/78. His hands and feet were warmer. The brain fog lifted. His doctor was able to reduce one of his medications. Now, I want to be very clear about something. Raymond did not stop taking his blood pressure medication because he started humming. He worked with his physician. They monitored his numbers together. And based on sustained improvement, his doctor made the clinical decision to adjust his treatment. This is not about replacing your medication. This is about supporting your body's natural blood pressure regulating systems alongside your medical treatment. Comment rethinking if this is changing how you think about breathing. Let me explain exactly what nitric oxide does, because understanding this will help you understand why everything I'm about to teach you works. Nitric oxide is produced by cells lining your blood vessels, called endothelial cells. When nitric oxide is released, it diffuses into the smooth muscle cells surrounding your arteries. There, it activates an enzyme that causes those muscles to relax. Relaxed muscles mean wider blood vessels. Wider blood vessels mean lower resistance to blood flow. Lower resistance means lower blood pressure. It's elegant. It's simple. And it's happening inside you right now. But here's the problem. Studies show that endothelial dysfunction, which essentially means impaired nitric oxide production, is one of the earliest events in the development of hypertension. Research published in the journal Hypertension found that patients with high blood pressure have a blunted arterial vasodilatory response, meaning their blood vessels don't relax as well as they should when nitric oxide is released. And inhibiting nitric oxide synthesis in animal studies causes blood pressure to increase dramatically. One study found that blocking nitric oxide production raised mean arterial pressure by 24 millimeters of mercury in humans. This molecule isn't optional. It's essential. So how do you support nitric oxide production naturally? There are 3 pathways. And I'm going to walk you through all of them. Pathway 1 is what I call the breathing pathway. Your paranasal sinuses produce nitric oxide continuously. By breathing through your nose, especially with humming, you deliver this nitric oxide directly to your lungs and bloodstream. Pathway 2 is the dietary pathway. Certain vegetables contain high levels of nitrates. When you eat them, bacteria in your mouth convert nitrate to nitrite, which then converts to nitric oxide in your stomach and bloodstream. This is called the enterosalivary pathway. Pathway 3 is the enzyme pathway. Your endothelial cells produce nitric oxide from the amino acid L-arginine using an enzyme called nitric oxide synthase. Exercise, adequate sleep, and reducing oxidative stress support this pathway. Today, I'm focusing on pathways 1 and 2, because they give you the most immediate, actionable strategies. Let me teach you the humming technique. This is based on research from the Karolinska Institute and studies on Brahmari pranayama. The technique is simple, but the science behind it is profound. Sit comfortably with your spine straight. You can be in a chair or on the floor, whatever works for you. Close your mouth and relax your jaw. Your teeth should be slightly parted but your lips together. Take a slow, deep breath in through your nose. Fill your lungs completely. This should take about 4 to 5 seconds. Now, as you exhale through your nose, make a low humming sound like a bee. Let the sound vibrate in your sinuses, your throat, your chest. This exhalation should be slow and controlled, lasting about 10 to 15 seconds. That's one cycle. The research suggests that low-frequency humming, around 130 Hz, produces the greatest amount of nitric oxide release. You don't need perfect pitch. Just aim for a comfortable, low to medium hum. Research found that consecutive humming with short intervals actually reduces the nitric oxide peak, because you're depleting the stores faster than they can refill. So space your hums at least a minute apart, or do short sessions of 3 to 5 hums followed by a few minutes of rest. For best results, practice this for 3 to 5 minutes, twice daily. Morning and evening work well for most people. Some research suggests that optimal nitric oxide release happens when you breathe more slowly, allowing nitric oxide to build up in the nasal cavity between breaths. So don't rush it. Comment, "Trying this," if you're going to give this technique a shot this week. Now let me talk about the dietary pathway, because this is equally powerful. Your body can convert dietary nitrates from vegetables into nitric oxide, and the research here is robust. A systematic review and meta-analysis published in the Journal of Nutrition analyzed 16 randomized clinical trials, and found that inorganic nitrate and beetroot juice supplementation was associated with a significant reduction in systolic blood pressure. The average reduction was about 4 to 5 millimeters of mercury. A landmark 2015 study in hypertension followed 68 patients with hypertension and found that daily dietary nitrate from beetroot juice reduced clinic systolic blood pressure by about 8 millimeters of mercury over 4 weeks. That's a meaningful clinical reduction. But here's what most people don't realize. Beets aren't even the highest nitrate vegetable. Arugula contains approximately 480 milligrams of nitrate per 100 grams. That's roughly 18 times more nitrate than kale. Research from Spain found arugula with median nitrate levels over 3,100 milligrams per kilogram. Spinach is another powerhouse. 1 cup of raw spinach can boost salivary nitrate levels 8-fold. Swiss chard, beet greens, butter lettuce, and cilantro are all excellent sources. The pattern is clear. Leafy greens win the day for nitrate content. Now here's the critical part that makes this dietary pathway work. The conversion of nitrate to nitrite happens in your mouth. Bacteria on your tongue, particularly on the back surface, are responsible for this conversion. And this brings me to the warning I need to give you. If you're using antiseptic mouthwash regularly, you may be undermining your body's ability to produce nitric oxide from dietary nitrates. A study published in Free Radical Biology and Medicine found that using chlorhexidine mouthwash after consuming beetroot juice significantly reduced salivary and plasma nitrite levels, blunting the blood pressure-lowering effects of dietary nitrate. Research from the San Juan Overweight Adults Longitudinal Study found that people who used over-the-counter mouthwash twice daily had an increased risk of developing hypertension compared to those who used it less frequently. A comprehensive review published in Intensive Care Medicine stated that because antiseptic mouthwashes eradicate the oral bacterial flora, the nitric oxide generating pathway is abolished. I'm not telling you to abandon oral hygiene, but if you're using strong antiseptic mouthwash daily, especially twice daily, and you're concerned about your blood pressure, this is worth discussing with your dentist. There are gentler alternatives. Some people use coconut oil pulling or essential oil-based rinses that don't destroy nitrate-reducing bacteria as aggressively. Others simply reduce mouthwash frequency to occasional use rather than daily habit. Comment, "Just learned," "Already knew," or "Implementing," based on where you are with this information. Let me tell you about another patient, a woman I'll call Patricia. Patricia was 78 years old. She'd been on blood pressure medication for 12 years. Her numbers were stable but not great, usually around 142/88. What caught my attention was her diet. Patricia was a vegetarian. She ate salads almost every day. But when I asked about the specifics, she was eating mostly iceberg lettuce, cucumbers, and tomatoes. Iceberg lettuce has some nitrates, but nowhere near as much as arugula or spinach. Cucumbers and tomatoes are negligible sources. I suggested she swap iceberg for arugula as her salad base. Add a handful of spinach. Include a few slices of cooked beet a few times per week. I also asked about her oral care routine. She used mouthwash twice daily, morning and night. She'd been doing it for 30 years because her previous dentist recommended it for gum health. We discussed the research. She decided to switch to once daily, in the evening only, and chose a gentler formula. 4 weeks later, her blood pressure was 132/82. 8 weeks later, it was 126/78. Her doctor reduced one of her medications by half. Patricia didn't make dramatic changes. She made targeted, evidence-based changes. Arugula instead of iceberg. Spinach added to her smoothies. Beet slices on her salads. Less aggressive mouthwash use. And the nasal breathing and humming practice I taught her. Just a few minutes each day. These strategies supported her body's natural ability to produce nitric oxide, and the results followed. Now, here's my protocol for you. This is what I recommend based on the research. Step 1. Become aware of your breathing. Notice throughout the day whether you're breathing through your nose or your mouth. If your mouth is open, close it. If you're congested, work with your doctor to address that. Nasal breathing should be your default. Step 2. Practice the humming breath technique for 3 to 5 minutes, twice daily, morning and evening. Low hum, slow exhale, space your hums at least a minute apart, or do short clusters followed by rest. Step 3. Increase your intake of high-nitrate vegetables. Arugula is the champion, followed by spinach, Swiss chard, beet greens, and beets themselves. Aim for 1 to 2 servings of high-nitrate vegetables daily. Step 4. Evaluate your mouthwash use. If you're using strong antiseptic mouthwash twice daily, consider reducing frequency or switching to a gentler product. Discuss this with your dentist. Step 5. Give it time. The acute effects of humming on nitric oxide can be measured immediately. The dietary effects build over weeks. Sustained improvement typically becomes evident within 4 to 8 weeks of consistent practice. And step 6. Work with your doctor. Bring this information to your next appointment. Discuss it together. Monitor your blood pressure at home so you have data to share. If your numbers improve significantly and consistently, your doctor may consider adjusting your treatment. I want to be absolutely clear about what this video does not claim. This video does not claim that humming or eating arugula will cure hypertension. It does not claim you should stop your blood pressure medication. It does not claim these strategies replace medical treatment. What it does claim, based on peer-reviewed research, is that supporting your body's nitric oxide production through nasal breathing, humming, and dietary nitrates may help optimize your blood pressure alongside your current treatment. These are complementary strategies, not replacements. If you have chronic kidney disease stage 3B or worse, talk to your doctor before significantly increasing potassium-rich greens like spinach and beet greens. If you're on blood thinners, certain vegetables can affect medication levels. If you have any medical condition, always collaborate with your healthcare provider before making changes. I've seen patients make remarkable progress with these simple strategies. Not because they abandoned medical care, but because they supported their body's natural systems while working with their physicians. If you found this genuinely valuable, consider using Super Thanks below. It highlights your comments so my team can prioritize responding to your specific health questions. For those of you who want this entire protocol in a printable format you can hand to your doctor, Pure Longevity VIP members get downloadable checklists of every video in large, easy-to-read font. The link is in the description. Let me leave you with this. Your body wants to be healthy. It has systems designed to keep your blood pressure stable, your vessels flexible, your circulation flowing. Nitric oxide is central to those systems. Modern life conspires against those systems. Mouth breathing, processed foods, antiseptic mouthwash, sedentary habits. All of these can impair nitric oxide production. But you can push back. You can breathe through your nose. You can hum for 3 minutes a day. You can eat arugula instead of iceberg lettuce. You can reconsider daily mouthwash. These are small changes, but the molecule they support, nitric oxide, is fundamental to cardiovascular health. Comment. Talking to my doctor if you're planning to bring this up at your next appointment. I want to know how many of you are taking action. Share this video with someone who could benefit. A spouse, a sibling, a friend struggling with blood pressure. The information here could change their approach, and subscribe if you haven't already. I release evidence-based health content for adults over 60 every week, and each video could contain the one insight that shifts your health trajectory. You have more control than you think. Breathe through your nose. Hum like a bee. Eat your greens. And watch what happens when you support the molecule that keeps your blood vessels young. I'll see you in the next video.